created to flow funding to doctors to buy EMR hardware and software. 2 years ago, in the non-agreement between the Ministry of Health and the OMA, that money went back to the Ministry of Health. So we no longer fund doctors except those who had signed previous contracts. We have about 3,500 doctors that still are receiving money from us because they signed before that contract ended, and that money will run out December of 2018. So we're no longer really in the business of implementation. We're really moving into the world of EMR maturity and trying to get doctors to do more with their systems, to use their EMRs as more than just data collecting tools. We're trying to figure out what it looks like to visualize data, to provide analytics in this space, to let quality improvement happen with easier tools than just simply EMR searches. So we're getting to this world now of complexity. We're measuring maturity, we're starting to report it, and map that up against other indicators happening at the provincial level, like how long have you been in practice, how long you've been in a primary care model, how big is your group? And we just published our first academic paper on that maturity model this month, actually, so you can see it out there in the literature. So we're doing some really interesting stuff. But the big world that we work in front of doctors is to try to translate what is the system priority coming from the ministry, agencies, et cetera, to their actual practice. So we call this policy to practice. There's hardly anybody living in that middle layer. So we have lots of agencies building really nice things, but no one really doing change management in the same way as we have 55 field team members, 60 physician, nursing, and office management peer leaders working directly with practices to do this translation and to say, what does it mean to say you need to measure? What does it look like to actually measure? And then what do you do with the results? So this is really, really exciting time for us because we see growth in the QI world, data quality, data portability space, and we have to operate in the neutral zone politically. We have to work on trust. Since we don't have money anymore, we have to work on trust. And that's been a really difficult thing to maintain, but I think one of the things we've done really, really well over the last 2 to 3 years. So we're really excited about those expanded roles, the expanded responsibilities, and then as well, the new governance world we're getting into as a for-profit company. These are the services we offer. I won't spend much time on this, but we do have Hospital Report Manager, now rebranded Health Report Manager, because we're delivering all kinds of documents from non-hospital facilities now directly into the EMR of physicians. Our EMR certification program is being rebranded. We're moving up into open certification to try to figure out how we can include more EMRs where necessary, and sometimes even hospital-based systems that are going to work in the ambulatory care space. The physician dashboard is our first view in partnership with Telus and Oscar EMR, first view at visualization of data in real time from an EMR on 17 provincial level indicators. Our assessment tool called the EPA is our maturity model. The practice enhancement program is a deep dive quality improvement program in practices using indicators that matter to the practice and helping them drive through an improvement effort. And the EMR Every Step conferences are our big educational events. So the Toronto one gets about 1,000 people to it. Second largest e-health conference in Canada every year. And we have another one in Ottawa coming up in June.